Hello, my name is Campbell Williams. I'm a nationally registered advanced EMT with Augusta County Fire Rescue and a paramedic student with Virginia Commonwealth University. I'm here to speak with you today about management of fevers in pediatric patients. So let's kind of lay the foundation. What is a fever emergency and why is it important to understand where it is coming from? So fevers are common pediatric complaints that we see in the field. However, often is not a true medical emergency. Most of the time, this is a symptom of an underlying issue, like an infection or an inflammation of some type. A fever is defined by any body temperature that is greater than 100.4 degrees Fahrenheit, which is equivalent to 38 degrees Celsius. So why is this important? In many children, most ranging from 0 to 2 months, the only presenting sign that we're going to see for infection is a fever, and it may be mild in nature. These kids don't really have the mental aptitude or mental capability yet in their developmental process to be able to correctly identify and display what kind of issues they're having, whether they have a tummy ache, headache, things of that nature. So a lot of times a fever is going to be all that we're going to see that kind of clues us in and starts us down our assessment path. So when we're assessing these kids, we want to record temperatures along with our vital signs. So every 5 to 15 minutes, depending on the severity of your patient. Unfortunately, rectal temperatures are the most accurate. I know at least for my jurisdiction, we do not carry rectal thermometers on our ambulances. And you kind of just got to go with what your department has on that. The biggest thing that we want to do is recognize that there is a fever though. It's not necessarily what the temperature is, unless we're getting way up into the temperatures. We just want to be able to recognize that this kid is febrile. And like I was saying earlier, fevers can help clue us in to more serious issues like pneumonia, sepsis, or meningitis. All of these illnesses are life-threatening and they do require immediate transport. So a big thing that we want to try to do is we want to do a very, very detailed, thorough secondary assessment. This is going to help us figure out the underlying problem. And honestly, we want to try to perform this on scene so that we're appropriately choosing our destination facility. I know for us, we're close to UVA for pediatric care, and for you guys in the class that are in Richmond area or that kind of general area of the state, you're probably going to elect, maybe if this is a more serious kid, to elect to go to VCU Children's Hospital as opposed to your standard ER that you normally transport to. So as far as treating in the field, a child with just a simple fever, they're probably not going to require a lot of intervention as far as we go. The biggest thing we want to do is support ABCs as needed, just like with any patient. And like I said earlier, fever alone is not dangerous. Temperature control will not only assist in patient presentation though, but it will also make the child feel much better. And when the kid's happy in the back of the ambulance, everybody is happy. So we can decide to start treating this en route to the hospital though. We want to consider treating with ibuprofen or acetaminophen. If at all possible, we do want to avoid aspirin in children. The use of aspirin in peds has been linked to Rey syndrome, which can result in cerebral edema and liver failure. So we want to kind of steer away from that if at all possible. So in adults, active cooling is kind of the name of the game. We're going to put ice packs in the extremities and in the joints, I guess you could say. But in kids, we really want to kind of limit that. We don't want to drop their temperature too quick. We want to limit what we do for the kid as far as active cooling to just undressing the child. And as always, during transport, we want to continually reassess for clinical deterioration. And if we need to change the destination to get a more appropriate care. All right, guys, thank you. And I hope you learned a little something today about fevers in pediatrics.